gotten permission from our IRB board to conduct a new study. So how will we know what's a good research versus a predatory journal article, right? So the answer in this question is going to lie in using appropriate resources. So what are a reliable source of information? You guys can put that in the chats for me. Who can tell me what's a reliable source of information? And so, you know, you guys know probably have been in school and used a lot of these, but things like CINAHL, EBSCOhost, ProQuest, you know, Science Direct, CDC, Gale One Files, these are all going to be reliable sources of information. Of course, the other thing is thinking about your accrediting body as well. So like maybe you work GYN, you know, ACOG, right? That would be some guidelines that we know are pretty reliable. So just paying attention to making sure that you're using the correct methodology of scouring for your resource. That will be like number one key critical thing, and you'll see why as we go along here. All right, MRAD, this has been around since the 1940s. I have put where I kind of got some of this information from for you in an article here. I've linked it back. You guys can look at that, and I've just kind of summed that article up here. MRAD has been around for a long time, like we talked about, kind of started in around World War II time frame, and this has become standard and widely accepted as one of the main styles of presentation of research. The New England Journal of Medicine adopted this like back in the 1950s, and then several other sources have as well. And then the MRAD always is going to start really general, asking things like given the introduction or maybe a little abstract, and then also thinking about methodology, results, that's going to get more specific, and then discussion, okay? And when we start looking at the discussion, it's going to kind of go back to general information, right? So thinking about the why, how, what, and the so what's here, it's going to go from general to specific. And if you look up MRAD on there, it's going to kind of give you like a wine glass or an hourglass type shape as it describes in that journal that I've put there for you. And, you know, just talking about how it kind of narrows it down and then kind of goes back out to general. Also, think about the dissemination of the research. So we have a research article that we might be reading, but how do we actually come to find out about the information? When we get new guidelines updated, or you know, maybe you're using some sort of source to condense new updates for you, where are we getting our information from is important, but then also how is it being disseminated? So some of the things that we're using in today's world are when we go to a conference, or maybe we're reading a textbook, maybe we're reading a journal article, maybe like right now we're using the media to get out information. And so a lot of times these are mainstream ways that we're going to use this, you know, public service announcements, you know, when the flu shot comes out or whatever. That's how we can disseminate or disseminate how we can get the information to the masses, to all the stakeholders, right? The public. And you can see here, I've put the fisherman and the shark here. And so we're the fishermen searching for information, the researcher, the clinician, whoever's coming up with the question. And but then I've got here a shark lurking in the water, and that's just again to remind you that it is our responsibility to ensure that the research that we're spreading around, the information that we're giving, is always going to be thoroughly looked at. It's going to be used with critical thinking and reasoning that we have in our background, our education, because as we're talking to these patients, we want to ensure that the public is not receiving incorrect information from some sort of unreliable source. So again, this slide just kind of talks to us about how the information is gathered, how it can be distributed, and you know, let everybody kind of know all the way down to the general public, and making sure that our resources are going to be reliable, that they're going to be coming from a nice, solid, sound source versus some sort of predatory issue. Okay, now I love this research hierarchy. I could talk about this probably for the entire hour. I'm not going to, but what I do want to show is I want to pull out a few specific things for you all in this pyramid. So even using the good search engines, you're going to discover many different types of studies. You may have some of those buzzwords in there, prospective study or a longitudinal study or a systematic review, as we talked about in the beginning, right? And so this little pyramid comes from Glover, Izzo, Odato, and Lay. And you can see the higher up that we go on the pyramid, right, the more evidence is on the study. Some of these are just, you can't help it, right? Expert opinion is going to be low, or background information, because you got to start somewhere, right? And you have to start to answer your question, maybe back to the question we started at the beginning, which was about EKGs in diabetic women. We might start by asking a cardiologist we know, or maybe an emergency room physician that we know, and we're going to start there. The next thing you might do is start to use some sort of search engine that is going to be, again, reliable. So EBSCOhost, something like that. And you're going to find some systematic reviews that have been conducted, meta-analysis that's been conducted at the very top there. And those are going to be pretty reliable sources, as they're going to take into account multiple studies combined. So that's what makes these so, the weight so good. That's why these systematic reviews and with the meta-analysis are at the top, because it's taking multiple different research studies and conglomerating them all down together into some numbers and statistical evidence there. The other thing is that after you've done that, you might start looking at some case studies. You might read a paper on an expert opinion from a top cardiology journal. You might decide that you want to add to your growing evidence of research and conduct your own randomized control trial at your own place of employment. Again, back to using those ethical rules, right, which we talked about. The patients have to have consent. They can withdraw at any time. They can, like as they withdraw, and they understand all of the implications. If you don't get an EKG when you're having chest pain, that could be a bad outcome, right? So looking at that, making sure it's ethical and logical for them. And then that's going to be the way to contribute to this growing evidence. And then you might continue up this hierarchy until you can continue through that research that can be conducted. So again, the main takeaway I want you to think about here is that the higher up you go on the pyramid, the more evidence we have, because there are multiple things combined. Also, you have to start somewhere. So maybe you start with the things that you do know, i.e. a cardiologist you work with. B, you're going to look at the case studies, read a paper on an expert opinion here in the middle, and then you'll start with your search engine to get that filtered information. And again, continue to work your way up. So that's just a good way that's kind of how my brain looks at it. Yours might look at it differently, and that's okay. I want to try to present this information to you like in a variety of ways. All right, so highest research level. So back to our pyramid, we're going to start building it up. So we're going to be up here at the top of the triangle right now, okay? Obviously, these systematic reviews, randomized control trials, is more in the middle, but meta-analysis with a systematic review, that's what's going to flow and lead into clinical practice guidelines. We have to have a very, very solid structure with which to build this, because this is really the one that's implementing into practice that becomes kind of the gold standards. And so we want to make sure that these are really solid things that we are going to want to build our foundation of our practice on, right? So let's go through and look exactly at each type of study that you're going to encounter when you're answering that question or any other question that we talked about, and see what is exactly behind all of our clinical practice guidelines. So I thought it would be really cool to kind of work our way from the top down and kind of see how these building blocks are put into place and examine that together. So at the very top, we have systematic review with a meta-analysis. Like I said, a meta-analysis will be performed at the very top of the systematic review process, and this is going to be considered the very highest level of evidence. And this is because a meta-analysis combines several systematic reviews into one statistical result. The side note here is that you don't have to have one without the other. Sometimes you will see these stand alone. So don't stress too much if you see one without the other, it's okay. There are international guidelines called PRISMA guidelines, okay? And I've put a link down here for you. It's active. You can just click on that. That's where I got this information. PRISMA is going to stand for the Preferred Reporting Items for Systematic Review and Meta-Analysis. This is essentially a checklist used to improve transparency in systematic reviews and encompass every part of the study from abstract to conclusion. PRISMA states that they exist to help authors transparently report why their systematic review was done, what methods they used, and what they found. Again, that comes directly from that link on the PRISMA website, okay? And you can read more on their mission in their statement on the link I provided. Of course, there are always drawbacks to any research method. You will find that none of these are perfect, okay? And this one also has some flaws. Some common ones always include things like bias, which is for most of these studies, small sample size, because again, if people are dropping out, they have to get all the way to the top of that pyramid. And then also time constraints and, simply put, poor study results. So if I don't have really good information, when I conglomerate all that, statistical goo in there, if you will, I'm going to come out with a mess. So I really have to make sure that everything I have when I'm trying to put it together is very solid. However, the benefit always is going to probably outweigh the risk on this one. And so increase the accuracy of several small studies. Determining statistical significance can be invaluable when we are working on the guidelines. So these methods will still end up sitting at the very top of the hierarchy, regardless of the limitations that they have. Okay. And so, again, the meta-analysis is performed when the results of several systematic reviews are statistically combined. So that's your information for that. All right, let's go ahead and talk here. We have study levels, so kind of getting to the middle of that pyramid, okay? So I have the guy here climbing up. So far, we know we need a good sample size, transparency, a defined process, that's per PRISMA, right, to repeat methodology and hopefully produce the same outcome every time, right? It's, if everybody always gets an EKG when they have chest pain and we're catching MIs, well, that's a good outcome, right? And so, what about the actual research experiment? So in previous studies, these are going to rely on completed relevant research, but the highest level of a study that can be conducted will be the randomized control trial. So that is going to be, for example, one lotion moisturized skin better compared to another. Well, you've heard people claim that or whatever, right? But the randomized control trial, the researcher would choose the test sample from a specific population, such as the skin type. So, they all have oily skin or they all had dry skin, whatever it be, and that's going to be a randomized controlled trial. Sticky note here for you on randomized controlled trials is some terminology you should be aware of, and that's blinding. So blinding research trials can be blind or double blind. If it is blind, means the researchers or the test subjects are unaware of which group that they'll be placed in. So did they use the control lotion and then did the other one get the new lotion? Or double blind would be neither the researchers or the test subjects are aware of which group the participants were placed in. So, that goes back to making sure that information is stored separately and the researchers don't know. And I can be like, oh, your skin looks good and yours doesn't. And they may have used the new product. We don't know because we're blind, right? Also, cohort studies would be next after this. These are going to be a type of longitudinal study. However, the reason that they get put up a little bit higher on the hierarchy is because this group is actually going to be followed over a long time to observe the relationship between the risk factor and the disease that compares them. So, for example, a group of cigar smokers versus non-cigar smokers who are businessmen, they have to have something in common. So, in order to be a cohort study or a group study, if you will. So, the fact that they all work in business or finance world, whatever it be, that's what's going to make this a cohort study. And then cohort studies can be pretty expensive. These can be time consuming. Oftentimes participants will drop out or even die, which can obviously sometimes skew results. But these are a great way to study prognosis over time. The last one we have here, following down just a little bit, is case control studies. These are going to be a type of retrospective case studies. These are really good at generating ideas of possible outcomes. For example, the case group already has the problem, so we'll say exercise-induced asthma. They already have that diagnosis, and the control group does not, but they might still have the issue. So, shortness of breath with running. Well, that could be all kinds of things, right? They could be out of shape. They could have heart failure. They could have some other lung disease going on. And so what the researcher here is essentially asking themselves is, are the previous components of exposure more common in the cases versus the control group? So again, these are kind of our moderate levels here, starting with randomized controlled trials being the highest that we can have, flowing down to cohort studies and then case control studies. All right. Let's go ahead here and look at study levels. So for our lowest panel, so we have, this is the very bottom of the pyramid for you. Of course, our lowest levels of evidence are going to be those case studies or expert judgments or opinions, and either made by an individual or a group. But a really great place to start, nonetheless, as this can give us some leads as to where we want to go on our hierarchy journey, right? So these can be biased, these can be subjective, so we really need to take that into account when we're using these methods. However, there's still really a great place for this, right? We love to use case studies in medical training. We love to read editorials or expert opinions, or even talk to the specialist. And so also expert opinions can be also used in a court or an ethics case. So there is a place for this type of research for sure, or a type of study, should I say, for sure. We all know that, again, the case studies oftentimes can be used in medical training. It's still maintained as the #1 role in a pivotal role for an individual review in training in medicine. And then also the other thing I want to just bring to you here is a Delphi panel. What is a Delphi panel? I didn't know what it was until I really started reviewing for this lecture here. This was a term used in the 1950s during the Cold War, and it's a structured method of developing consensus to develop best practice in medicine. So this can serve as a guide where kind of expert opinion when research is limited. Think about ethical considerations or logistical difficulties. We're not going to do the same things that we do to the lab rats or a rabbit that we would a human, right? So sometimes we just have logistical barriers to getting and obtaining the research here. And so a lot of times, thinking about an anonymous survey of several experts, just that referred to as panelists, we may ensure that some of these trials are, being legit here. So I can always find something to compare and contrast myself. So this is where the anonymous panel comes in, and making sure that they're anonymous really helps to keep this, a little bit less biased. However, the drawbacks to this method, again, why does it still follow on the lowest part of the pyramid, is the attempts to standardize this method have been varied at best. There's no actual defined process. And so those are really big hindrances to this method, and why it still falls in that lower category. Some ways that they have worked to overcome this in the past in the real world would be careful participant selection, anonymity, consensus criteria. Again, so no one way is going to be perfect or ideal, but again, these lower study levels do have their place. So kind of going back through that pyramid for you guys. All right, let's talk about research types. Let's talk about some lingo that you'll hear. I kind of gave you some terminology at the forefront, but let's talk about some other research types, some study types that you'll kind of hear when you're reading through these articles. So prospective would be data collected over time as the circumstances change and the outcomes are observed. So these are going to be a type of observational study. There's not always a firm plan. The researchers are just kind of following along with this group of people, collecting data as their circumstances change, right? They often are going to be observed through things like questionnaires or evaluations, things like that. They oftentimes do not have any evidence of disease. So, but they might have a known risk factor. In fact, for a prospective study, most of them do have a known risk factor. And then unknown outcome. Again, the researchers aren't planning any outcomes for these people because there's no evidence of disease at that time, right? So how are they going to know if X number of people develop whatever it be due to their risk factors? So they can't really have any firm planned outcomes. And again, the outcome is pretty much going to stay unknown throughout the study. A retrospective type of research here compares the outcomes. So I want you to think about compare and contrast. So those who have something versus those who don't have something. It's going to look at comparison. It's going to look back over a long period of time. So this person must have a risk factor exposure of disease. So for example, they smoked 40 years ago, or they were exposed to, asbestos, at their job, but now they're retired. It looks back over a period of time. And then also multiple types can be done of retrospective study. You can have, this is where the case study reviews kind of come into play. This is where case controls live. So those are types of retrospective studies. They fall up under that umbrella, if you will. All right, the next one we have is longitudinal. That's going to be that study over a period of time. So I think about the word long for this one. They are going to be continuously monitoring these people. These are going to be repeated measures over a long period of time. These are going to be conducted at intervals that have been meticulously timed. So every year, the researchers will bring these people back and they'll do, the same lab draw or the same test or whatever it be. Just a little side note here, if you hear about a cohort study being done, that's just a type of longitudinal. It follows up under that umbrella, and it's the highest level of study because it follows to exposed versus not exposed. So again, just nothing to like memorize here, but just kind of knowing where those words fall kind of helps to, put them into perspective for you. All right, so let's go ahead and practice. We're going to combine this entire section. We're going to do some practice questions so that we can clear up any confusion, because this really can be a difficult topic, especially on boards. And so I kind of want to switch gears here after we've talked about, the types of research, and we've talked about, the dissemination of the material, making sure that we have a correct question in the right format, making sure that we're studying and looking at everything against the guidelines. We're going to go ahead and start applying some of this. Before we get into the questions today, I want to just give you like a really quick reminder that if you want more practice questions at any time, we're always running our free trial. Right now, I think it's going on for about 7 days, and you can use the QBank. We have currently almost 1,600 questions in there, and then if you want more information on this topic, maybe you do set up a tutoring session. Maybe you do purchase the on-demand, because these are going to be bite-sized contents for you, more in depth than we can cover today. And then, of course, just a reminder, as I mentioned at the very beginning of today's time, was we have our live review, 3 days coming up. All you need to know for the exam prep, if that's really what you want to focus on. And so we've got the QR code for you to register today. Of course, as always, connect with us on Facebook, Instagram, TikTok, however you like to connect on your social media accounts. And then if you have specific questions, as always, you can email us here at Archer Review, Nurse Practitioner at archerreview.com. So before we get started, do we have any questions at this time? Feel free to put them in the chat. Again, I like y'all to be interactive. I like to review things with you. So if there's something you want to kind of go back over and look at or whatever, we have a few minutes today. So let's go ahead and start with our practice questions. We have several for you today. So the nurse practitioner has been tasked to help lead a committee at the healthcare facility to develop a new protocol for sliding scale insulin. The team decides to scour as many sources as they can to gain a better understanding of the existing research and guidelines. They set a time to brainstorm and present their findings to the group next week. And this process is best known as what? A, a systematic review, B, a case study, C, a prospective study, or D, a literature review. So what are you guys thinking as far as what you have learned here based upon this lecture? We didn't talk too much about this today, but again, we're kind of thinking about low level here, scouring our sources. So what do y'all think? Y'all can put it in the chats. Just a minute. Absolutely. A literature review. So the literature review is when you look at the current research that's already been conducted to find out what's already out there on the topic. So remember at the beginning, we kind of talked about for just a minute about maybe you have to start kind of low and go slow a lot of times. And so we're just gathering our resources together. This is one of the first steps of the research process. And a case study is when someone is faced with a particular problem that facilitates their learning using a variety of data sources. I'm sure we've all done a case study. Usually looks at an individual, right? Mrs. Parker, who's 34 years old, and XYZ, right? Usually looks at an individual there. A prospective study is when individuals are followed over time as their circumstances change. And a systematic review is very focused and might be conducted later on in the scenario. So we talked about how systematic review is going to be at the very top. So ideally, they would conduct a systematic review on this team before they try to start disseminating practice or changing their practice, before they have really gotten enough evidence there. So that's going to be important for them to do before they start changing the practice changes. All right. Practice question 2. So you're reading through a nursing journal. You come across a particular article that piques your interest. The abstract discusses that the researchers wanted to know how often patients with CKD experience proteinuria, and the data was compiled from 20 different renal clinics. What type of study do you suspect was conducted? So what are you thinking here? So is it a qualitative, B, quantitative, C, a meta-analysis, or D, longitudinal? What are you guys thinking? So you can put your comment in the chat. You can put your number in the chat, your letter in the chat, A, B, C, or D. Take a guess. We're not counting grades today. This is just for you to practice. I'd rather you miss it here than on your boards. Okay, absolutely, B. So anytime there's a specific narrow question with numeric data analysis via statistics, we're dealing with some sort of quantitative study process. Qualitative studies are going to be usually based upon opinions, interviews, broader topics. Meta-analysis is the examination of several independent studies used to determine trends. And then again, remember the longitudinal is going to be repeated measures used to follow someone over a long period of time. So great job, guys. All right, practice question number 3 here. You're examining Mr. Jones, a 70-year-old veteran, during his annual wellness exam. Mr. Jones states he was exposed to Agent Orange during his time in the military and is participating in an upcoming clinical trial that compares those with healthy lung function. Based upon this statement, the MP suspects this is most likely what type of research? So again, do y'all think that this is going to be A, prospective, B, longitudinal, C, retrospective, or D, lateral? So you guys, I know you guys know this one. So again, let's pull out our key words here. He was exposed, right? He is participating in an upcoming clinical trial that compares those exposed to those with healthy lung function. So what type of research usually looks back? This one kind of has some was exposed and compares. Okay. Absolutely. You guys got this. So C, retrospective, right? Retrospective studies often contain data that compare those who have been exposed to those who have not been exposed. Again, longitudinal looks at individuals over a longer period of time, and a prospective study deals with collecting data on individuals who have changing circumstances or characteristics, such as following a child into adulthood would be an option. Lateral is not actually the type of research, so that was just thrown in there as a distractor. So don't let the distractors get you. All right, practice question number 4 here. The nurse practitioner is reading an article in an orthopedic journal discussing the statistical significance of a surgical site infection rate being higher among the patients in the 65 to 85 range versus those younger than 65 years old. Here's your p-value, 0.0122. The article states that the median age of patients experiencing a post-joint replacement surgery infection is 72 years old. Given this information, the nurse practitioner most likely concludes what? A, there's a stronger statistical significance of developing a post-surgical site infection among patients over the age of 65. B, there's a weaker statistical significance of developing a surgical site infection among the patients over the age of 65. There is a stronger statistical significance of developing a post-surgical site infection among patients under the age of 65. Or D, a weaker statistical significance of developing a surgical site infection among patients under the age of 65. So I want you to think about here, you know, compare and contrast, right? Compare and contrast this. So, you know, think about your p-value and what is it? I'm going to give you a hint. C and D, those are just repeated. They should say 85. And you can actually toss those out, so it doesn't matter. So go down between A and B. And usually, just a test-taking tip here, if there is some sort of polar opposites on a question, so the key word here is stronger or weaker, right? When you see that, if, let's say C and D were good answers, you would probably think to yourself, ooh, it may be one of the opposites there. So not always, but a lot of times when you're taking tests and you see one is high and one is low, or one is weak and one is strong, usually you can kind of narrow it down to those. So just think about that. So what are you thinking here? So your p-value, what's the importance of your p-value? Can you remember back to when we first started talking about the p-values? If you said A, you're absolutely right. P-values will be given as a decimal and then be converted to a percentage. A p-value of 0.0122 converts to 1.22%, which is a small percentage showing that there is a smaller chance of the results being random. Therefore, this is going to increase the strength of the statistical significance. So remember, we talked about how those p-values, we want them to be as small as possible, right? All right, so here's another question for you. The nurse practitioner is examining Alex, an 8-year-old in an urgent care setting. This child's mother states that he is adopted and he experienced fetal alcohol syndrome at birth. She states Alex has been in a research study to determine the effects of fetal alcohol syndrome since he was 2 years old that will follow him until he is 22 years old. The nurse practitioner suspects this child is enrolled in what type of study? And this is a select all that apply. This is a hard one. This one here is, I want you to think about when you have select all that applies, I want you to think about turning it all into true and false. So true or false, could it be a cohort? True or false, could it be a longitudinal? True or false, could it be systematic? Or true or false, could it be retrospective? I want you to pick out which ones you think, and I want you to think about the long term. That's going to be one of your key words here when you're really breaking down these questions. If you don't know 100%, you know, rely on some of those test-taking tips and strategies as you're going through here to take your best guess. We don't want to throw any questions away, right? So if you're not sure, think about taking your best guess here. So what do you all think that it might be? Absolutely. This is A and B, right? So a longitudinal study is going to deal with collecting data on individuals over a long period of time with continuous monitoring. And the cohort study is going to be the highest level of the longitudinal study umbrella, right? That strengthens the evidence of determining impact. Systematic will be a type of review process versus an actual study type, because we talked about systematic reviews. And then a retrospective study is just like the guy with the Agent Orange. They contain data that compares a control group to the trial group. They look back. So anytime worth looking at something over a long period of time, which 20 years is pretty long, this can be considered as a longitudinal study a lot of times. And again, the kid has a common denominator with his people in his cohort of fetal alcohol syndrome. And so that's going to be cohort and longitudinal. So that was A and B. Great job, you guys. I hope that this has been helpful for you. It was definitely something that kind of made me nervous when I was a student. But believe it or not, I was actually sitting yesterday with another nurse practitioner, and she was getting articles for Journal Club that they were doing at their office. The physician had asked her, is asking all the nurse practitioners to kind of go around and come up with some journal articles from reliable sources. Again, he was expecting them to be able to decipher what's reliable and what's not, and be able to kind of break down what the study was showing so that they, is it something that they want to implement into their practice or not? So this really is important. I don't even think that it seems daunting in school. It seems way up here, but when you start looking at it and you start realizing that you're actually already doing this, you're doing this every single day. You're doing this when you write papers, right? You're learning this when you are in practice and you're looking up guidelines. And so again, this is just something that is going to be with you. It's going to stick with you. It's important to kind of understand the lingo and the terminology. And again, you can, email us for questions that you have specifically. We're going to try to just continue to add to this webinar as we go along, and, maybe repeat it again later on this fall. You can kind of circle back around then if you are getting close to taking boards. And then again, just as a reminder here for the end of the day, or the end of our time together, if you have questions, you can pop them in the chat. Laverta's been with us. Thank you, Laverta, for helping with chat today, helping with tech support. I appreciate that. Again, we have those resources for you. I won't reread them for you, but they are there. We'll stay on here for just another minute or so if you have any specific questions that we can help you with on this very important topic. So, is anybody have anything that they want to pop in, put on the chats? All right, well, we're going to go ahead and call it a day. But if there's anything else that we can help y'all with, if there's anything else that y'all, want to ask questions on, we're here. And we'll hope to see some of you guys at our webinars coming up. There's more this week. And next week, I'll be back with y'all again for another topic. And you can, reach out to us on our other platforms in the meantime. So y'all have a great Monday. Take care, and we'll talk to you soon.